Australian hospitals at risk of closing down. Let's have a look. Good morning, everyone. Florian.Heise here, and welcome to another episode of HeiseSays. I have my morning stein of coffee, and I thought we'd have a look at this article that was sent to me by a viewer from the Chronicle, because considering what's going on right now, it is frankly quite shocking and just shows that, well, all the moves by our leaders are probably more desperate than coordinated. Well, let me know what you all think in the comments, guys. Because Australian hospitals are shut with 100,000 staff under threat. Now we're facing a global pandemic, and infrastructure, once you shut down a ward, getting it back up again isn't easy. You can't just flick a switch. So this is quite concerning. Australian private and Catholic hospitals are about to be closed, and their staff stood down, putting 100,000 workers out of a job right as the hospital system is about to buckle under the weight of illness admissions. 100,000 workers. 100,000 health workers. The catastrophe is the result of a failure of state and federal governments to come up with a financial solution for the hospitals after they banned non-elective surgery at a national cabinet meeting earlier this week. So, are they actually aware of the implications of what they're doing, or are they just saying this is the sacrifice that we need to make to address this? Because here's the thing, guys, if every nation doesn't go as crazy as every other nation and eradicates this illness, it can come back. We could be seeing it come back again and again and again. And with the methodology that we're using to try and mitigate the impact on our health system, it's going to take us longer to build herd immunity as a civilization, as a species. So this all seems very messy, very concerning. But I guess, how else could you prepare? I know we did designs for mobile emergency accommodation deployment around at all the sports fields and soccer fields for the Queensland government. Maybe it's time they do the same thing, looking at deploying emergency portable hospital accommodation. But then again, if you've got all these hospitals that are shutting down. News Corp Australia reported Friday that 600 nurses have been stood down in New South Wales and more in Queensland, with the third largest hospital group, healthcare, was forced to cancel surgery. So 600 nurses, although I'm sure they'd be snapped up by the public sector right now. On Saturday, all the nation's private hospitals issued a warning. They too are on the brink as a result of the state and federal government decision. The nation will need access to the nation's 650 private hospitals as it tries to cope with demand from the illness outbreak. See, this is the thing. You're getting all these people, like America's just hit 100,000 infected. And even if the majority of people are fine, you're going to have some people that need hospital care. 650 hospitals, that's a lot of beds. It's a lot of ways to contain people, a lot of ways to monitor people. It's better to be there than not, isn't it? The Australian Private Hospital Association, Catholic Health Australia, and Day Hospitals Australia said the private sector is prepared to play their part in the fight against the illness, but cuts to elective surgery and a failure of state governments to step up to support the sector will have dire consequences for Australia's future hospital capacity. And we're just beginning down this path, guys. You've got to remember, whenever the government implements something to respond to the growth of the illness, the data they have is usually 2 weeks out of date. Particularly the deaths. It's a lagging indicator, guys. It's a lagging indicator. The hospitals are now faced with the very difficult decision to stand down staff and forlorn services as a direct result, just when the entire health system is bracing itself for the surge in patients. The Australian Private Hospitals Association chief, Michael Roth, said. Hospitals are demanding governments guarantee their viability. Well, see, here's the thing. The government is taking away their ability to generate revenue. So it's destroyed their business overnight. It's destroyed their business overnight. And if some people wish to have private health cover, pay extra to get a different level of service, is there an issue with that? Rachel had private health cover all the way preparing for baby. And then when she got it, when she had Mina, she realized all it got her was a private room across the road because we went to the Mater and a few extra little things. It wasn't worth it. The actual service that we got with the midwife group practice was much better for us, better quality. They actually come to your house, which is crazy. Although you're not allowed, well, you're expected to leave the hospital as fast as you can. So I think she stayed one night. That was the longest. Normally it's 4 hours in there and you're out. And then you're back home, which is great because it's freeing up resources in the hospital. Those beds to build in the hospital are expensive. And if everything is fine with the baby, they see it latching on, it's all good, no complications, it's safer, sometimes smarter for a mother to recover in a home environment. More comfortable. I know when the first time we were in the ward, there's this woman in the bed next, and she was just continuing the stereotype of intergenerational pain, just yelling abuse at a newborn child. I couldn't believe it. That was shocking. So that's kind of why I prefer coming home. And then the midwife is there the next day to check on you. Works. Anyway, that's where she kind of gave up on the private sector because it wasn't worth it. This is a better model. If they offered this service, if they offered a similar service to that, maybe they should. Maybe there's an opportunity. Because the one issue we have, and something I'm worried about now, is if Rachel goes to the labour here at home, which happens a lot faster the more births you have, the midwives won't come out. Maybe that's where we have to hire a doula or a midwife. Anyway, we'll have to see. We'll have to see. So between them, the private hospital system employs over 100,000 staff, including 57,000 nurses, across 650 hospital sites. There are well over 300 overnight acute private bed hospitals. More than a third of intensive care units are in private hospitals, according to the chief medical officer. We're potentially losing a third of our intensive care beds, guys. CHA Chief Executive Officer Pat Garcia said, "What should be happening at this time, in this breathing space we have before the full virus onslaught, is all hospitals turn their attention to training up their existing clinical staff and hiring additional staff, both clinical and non-clinical, to treat patients." Yes, that's what should be happening. Just think about this chart here that we all see all the time. This could reduce by a third. Have they taken that into account in their modelling? We also acknowledge that winter, which is just around the corner, tests the hospital system at the best of times, let alone when there's a global pandemic. Hospitals cannot simply close down entire wards and ICUs and turn them back on at the flick of a switch. If we need to close down wards and hospitals, they will not be available when we need them. Yeah, that's a big step, guys. I've worked on hospitals. We've designed these spaces, and I've gone through some of the old ones. It's crazy. Michael Roth, CEO of the Australian Private Hospitals Association, said, "The states don't seem to understand the urgency of reaching a deal this weekend. If they don't do that, the beds they need in a few weeks may no longer be there. What we need is a national network of hospitals coordinated between the states and the Commonwealth, and ensuring that our entire system is at full capacity. Without a Commonwealth guarantee, private hospitals will start shutting their doors from early next week." Now here's the issue we have. Could this lead to the nationalisation of the private health sector, guys? And could this remove opportunities for people? This is concerning. That's a scary prospect, honestly. Just talk to anyone about the inefficiencies in the health sector. You need some competition. Jane Griffith, CEO of Day Hospitals Australia, said, "We've seen what has been happening in Spain and Italy, where patients don't have access to ventilators and ICU beds. The capacity of the private hospital system in Australia is enormous. We must act now to ensure capacity is available when we need it." New South Wales Health said yesterday they're in negotiations with private hospitals. The private sector will cooperate in whatever way it can to assist all governments with the development of a national illness partnership. A number of for-profit and not-for-profit private hospitals are currently in discussions with the states and territories to assist in the development of mechanisms designed to maintain the viability of the clinical capacity provided by the private hospital sector. Nevertheless, the sector believes it is unlikely a nationally consistent position can be reached via individual negotiations with each of the states and territories in the time frames to maintain viability and capacity of the hospital sector. We could see the numbers here, guys. 3,500. That just has the potential to grow. So what do you think? What do you think? Where do you think this will lead? Could they have done it other ways? Does it show that our leaders aren't really planning this through? Could the continuation of elective surgeries, could that have been managed in a way? I mean, like, you wouldn't be able to keep social distancing in a surgery, and it could provide additional risks. We'll have to see, guys. We'll have to see. Let me know your thoughts and opinions, but I'm kind of worried about our healthcare capacity dropping by a third with ICUs. Let me know your thoughts and opinions in the comments below, guys. Please like, share, and subscribe to the channel. If you're a fan and you want to support us, there are a few ways you can. You can join the channel on YouTube or on Patreon for a small monthly fee. You can support us via our affiliate links at Amazon or eBay for your consumer purchases, or Independent Reserve and Kucoin for the crypto traders out there. We have merch available from the HeiseSays website, and we also have it available from Teespring. Pocket squares we make ourselves, and cups we're getting made from Teespring. You can donate via PayPal or using Gold Pass to send us gold. Thanks, everyone. Have a great day, and I'll see you next time.